So we concluded our topic of colorectal cancer, molecular pathogenesis, risk factors, screening and treatment, prevention, all that we covered in our four sections of the lecture. So now in this fifth section we will talk about the cancers of the anus, which is the last part of the gastrointestinal tract, and especially the lower GI tract, which is our topic for today. So we will discuss what is the cancer of the anus, what are different types that can occur of the cancer of the anus, what are these clinical features, and how we can treat this cancer. 1 to 2% of malignant tumor of the large bowel is the cancer of the anus. So it's not very high, incidence is not very high. Only 1 to 2% of the cancer of the lower GI tract or the large bowel is the cancer of the anus. From anorectal ring to zone between the pectinate line. So this extend from the anorectal ring. Anorectal ring is the ring where there is junction of the anus and the rectum, and then up to the pectinate line. Proximal to pectinate line, the tumors which are proximal to the pectinate line, they are basaloid, cuboidal, and cloacogenic. So these are the three types mainly associated with the tumors which are on the proximal side of the pectinate line. And then distal to the pectinate line, we have the tumors which are squamous in type, and mainly the rectal tumor are distal to the pectinate line, and they are about 55%. So far the incident is only 1 to 2% of all the cancers of the large bowel, and then we have 55% of these anal cancer are the one which is distal to the pectinate line, so in the lower portion, and they are squamous in type, and 55% is these squamous type cancer. These are the pictures of the growth coming from the anal canal, and you can see these are the cancers. Basaloid and squamous cell cancer associated with HPV infection and condyloma acuminate may be caused. So condyloma acuminate is the wart-like infection caused by human papilloma virus. Patients who it's a sexually transmitted type virus, and people who have in homosexual people who have AIDS, this is common. So mainly the HPV is associated with anal cancers of the basaloid and the squamous type, and they appear like the skin wart or viral warts which have the rough structure like a cauliflower-like structure. Clinical features, this is the anal cancer, this is the rectum, so high risk in homosexual males. In AIDS patient, features are there is bleeding, pain, perianal mass is present, and there is itching and pruritus. So perianal mass is an important presenting feature, and there is pain and bleeding. This is more common in patients who, in males who are homosexual, and patients who have AIDS, autoimmune deficiency syndrome. AIDS is also associated with the sexual priorities, and homosexuals have AIDS, gets AIDS more more commonly. So it's associated with the AIDS, and the virus that is associated with basaloid and squamous type of the rectal cancer is the HPV, human papilloma virus, that is cause the viral warts or condyloma acuminate. Treatment is this is the colostomy bag. Colostomy bag is the bag that is attached after the surgery. So all the fecal matter is collected in that colostomy bag, and it is removed and cleaned as required. So treatment is the abdominal perineal resection, lymph node sampling, permanent colostomy. This is the colostomy bag. Ostomy is the opening or the hole. Colo is for the colon. So this bag is attached to the colon. So the fecal matter is collected directly in the bag, and because of the tumor, anus and the rectum may be resected or removed. External beam radiation therapy, concomitant chemotherapy, and the drug commonly used as a chemotherapeutic drug is the 5-fluorouracil. So these are all the treatment options for the rectal anal cancer. So that was all about our lecture, Cancer of the Lower Gastrointestinal Tract, in which we talked in detail about the cancer of the colorectum and also cancer of the anus, which is more common in the patients who have homosexuality issues and then AIDS, and it is associated with HPV, human papilloma virus, and it caused the viral wart-like lesions or the growth, which you can see as a perianal mass and that protrudes out of the anus. So that concludes our lecture, and thank you for watching sqadia.com.